Good afternoon, and thank you for joining us for the March 2nd news conference for COVID-19. My name is Christine Messenger, and I'm one of the public information officers here at the COVID-19 Joint Information Center. Today, we're joined by Public Health Director Sophia Pereira and County Health Officer Dr. Ian Hoffman. Thank you both for being here. And Director Pereira, can you provide us with a few opening comments?
Yes, good afternoon or almost afternoon, everyone. Just a few things I wanted to touch on today. So you may have noticed this week we moved our COVID updates from 5 days a week to 3 times a week. And we expect to be moving to once a week very soon. We are making these transitions as we're scaling our COVID response appropriately to what we're seeing here in public health and in the community. We're also working on a plan to transition back to our normal media practices, where some of you may be familiar pre-COVID, you email DHHS media and, get a response through that standard process, outside of how we've been doing pressers, for example, throughout COVID. However, since for the next couple of months, we are going to be down a health officer, so we aren't going to be implementing that right away. But just wanted to let you know that we do have that plan to transition back to that normal practice that some of you may be familiar with. So speaking of transition, as you all know, Dr. Hoffman's last day with Humboldt County Public Health is this Friday. And I really just want to recognize him and his efforts for the past 15 months with Humboldt County Public Health. He has been incredible at capturing all of the changing guidance that has been happening throughout this incident, translating it for our community, translating it for our community partners, working closely with our community partners to make sure they had the information that they need to make informed decisions as things were rapidly changing. He was really instrumental in the vaccine effort and scaling that up. And so just want to, again, express our gratitude for Dr. Hoffman and wish you all the best on your next chapter. And we really could not have done this without you. So with that transition, though, I do just want to note, we do have 2 part-time health officers that have been supporting us throughout this response. So Dr. Kate Eslin and Dr. Donald Baird. They will continue to be on board with us to support us through this transition and help bridge the work that we do in public health. As you probably saw last week, we have other communicable disease concerns like Shigella. We have a public health clinic. We have other work that a health officer needs to be focused on. And so we're going to really be making sure that our 2 part-time health officers are dedicating their time to those core public health functions. So just want to let you know that we are going to have that support, but their time is really going to be focused on the operations of public health, where we really need health officer, medical director support and oversight. So again, we're right-sizing this response. We're scaling back things as necessary based on the data and based on what we're seeing on the ground. And one of the big things that I'm sure Dr. Hoffman will elaborate a bit more on is around the changes in masking policy. So right now, you may see I am wearing a mask still, and some of you may be going, why are you wearing a mask? You don't have to wear a mask anymore. Well, it is strongly recommended. We as public health join the state in strongly recommending that regardless of your vaccination status in public indoor spaces that you mask. And for me personally, given that I have folks in my family that I am working to protect, I make sure that I'm wearing my mask. So I just wanted to speak to that, that choice that we all have, and how, for many of us, there's going to be considerations for others and preventing spread in our community. And those are all important considerations about choosing to wear a mask. And I'll turn it over to Dr. Hoffman.
Well, thank you, Dr. Pereira. Really appreciate those kind words. And yeah, it's been quite a 15 months. I think, more than anything, I just want to thank everyone in this community for all that we've achieved. It has certainly been a community-wide effort that has allowed us to maintain and achieve a low death rate here in Humboldt County due to COVID-19, low hospitalizations, and a high vaccination rate. So it's been an effort that has taken all parts of our community, and I think it's been quite successful. I wanted to talk a little bit about the future changes too, and just review where we're headed with public health, and a little bit of where we've been. It's not typical in even an emergency, public health emergency, that we would require so many things of the public. It's been a really extraordinary response in that we did have so many requirements. Now that we're really coming to the other side of the pandemic and are approaching, hopefully soon, an endemic phase, we are going to be phasing out more and more requirements. So we saw that in the past few weeks with masking. We saw that in January with isolation and quarantine. Our public health authority is something that we take very seriously. And so we want to make sure we utilize that only when necessary. So moving from these requirements to recommendations is something that is consistent with that. And I think that, we will continue to move those recommendations along depending on the threat of COVID-19 to our community. So currently, masking is strongly recommended, still no longer required, but we will also update the community as the threat level decreases and move towards other recommendations, or potentially removing it as a recommendation entirely when there's less of a threat to the community. I think the other thing that we're seeing is this move towards more, at-home testing, at-home treatment. We had an announcement last night by the Biden administration, by President Biden, that they're going to be working on a test and treat strategy, which will allow people to get treatment without a doctor's order. I think that's a great move, and it will really help, especially in our community where medical access can be severely limited. So these are the kinds of things that will allow us to move towards that endemic phase of the pandemic. Like Director Pereira, I'm wearing a mask today because it is still strongly recommended by the CDC, given our high transmission rates in our area, and still recommended by CDPH. And I too have family members who I want to protect, family members who are high risk, and I want to protect my community. So I will continue to mask in public places, and in situations where I might be at higher risk to contract COVID-19, so that I don't pass it on to others in my family and my community. Lastly, I just want to again say, been asked a lot about what are my parting words to a future health officer. One, I just think that the support of my colleagues across the county, the support of the community has been extraordinary, and I can't say enough about what that means to have during this very difficult time that has been extraordinarily challenging, obviously, over the past 15 months, dealing with this deadly pandemic and coming out the other side with what I think are great results. So it's the support of those colleagues and community, folks here in public health, but across the board, and the emergency operations and government, the folks here at the JIC. We've worked closely with schools and businesses, hospitals, and I think all of that has really had a huge impact, including our close collaboration with all of you in the media, who have kept the message out to our community, keep them safe. I think that also has a huge impact and has contributed to clear communication to our community about what the risks are, and keeping our death rate low, our hospitalizations low, and our vaccination rates high. So my last words I'd say are, know that this is the greatest job that I've ever had, and I'm not leaving it lightly. I really do need to return to my family duties, and I hope that someday I can return to this kind of work again when it permits in my life. So thank you all for everything. It's been a wonderful time.
Thank you both. Now we'll take some questions from reporters. Ryan Hudson.
Thank you. So my question is regarding some discrepancies in local data, and a press release from the JIC of February 24th of last week reads, in part, just real quickly, that a calculation error involving the total percentage of Humboldt County residents aged 5 and older who are fully vaccinated was identified by a caller to the Joint Information Center. This error has been corrected. And as of Tuesday, which would have been, I suppose, last week, this reads a total of 87,791 residents, or nearly 69% of the county's population aged 5 and older, were fully vaccinated. And it says approximately 7% of the population aged 5 and older has been partially vaccinated as of the reporting period. So in light of this error, could you first please clarify the total population numbers that the county uses to determine their vaccination percentages, specifically the 5 and up total population numbers? And then secondly, in regard to the miscalculation of vaccination percentages, which did not include that group, is the county going to issue a retraction? Thank you.
Thanks, Ryan. So I appreciate the question. When an error is brought to our attention, we take it seriously. We have prided ourselves and we pride ourselves in making sure that we are providing accurate and clear information to the public, as you all have a similar call in your line of work. So that is why when it was brought to our attention, we immediately looked into it and made sure that we resolved it. And we issued a correction to make it very clear this is the correct information, and acknowledge that someone caught the error and notified us of it. And so that's a practice that we'll continue to do. If something gets lifted to us that we did not present certain information correctly, we will absolutely correct it. So that's been our practice. We'll continue to do it. And so just really appreciate people's due diligence and making sure that we're all doing our part in that. Right now, our epidemiology team, our Joint Information Center staff are really focused on launching our new dashboard, which I'm hoping will provide really great tools for people to look at the local data and the state data that is out there. There's lots of great state data that's out there as well. We have our current dashboard, and right now our staff are really working on this new dashboard that's going to really give people a lot of flexibility in looking at the numbers and understanding the numbers.
Thanks, Sophia. Ryan, do you have a follow-up?
Yeah, I do have a follow-up, but I also wanted to just reiterate, we would like to know the total population numbers that the county uses to determine the vaccination percentages that includes the 5 and up group. If you could give me that population total.
I don't have that on hand, but I think we provide the information in terms of our percentage population and how many people are vaccinated. So I believe we include that in our news release.
Okay, then my follow-up would be, in the absence of that specific number, in regard to improving the dashboard, as you mentioned, we're still anticipating those changes. Could you elaborate a little bit on what that would look like in terms of reflecting the vaccination percentages there? Visually, are we going to see a different type of graph, and will it include the total population? And then also, is there going to be any change in the zip code data over time? Thank you.
Thanks, Ryan. Definitely as we get closer to launching it, we'll definitely make sure to provide I think it'd be really helpful to provide an overview of explaining the new dashboard. So I definitely hope we'll have that opportunity. We are using a Tableau for our dashboard. And if you're familiar with Tableau, really great data visualization tool that is out there. There's really great features where people can interact with the data and be able to look at it in different timeframes. And be able to hover over things and get a little bit more detailed. It's much more user friendly for those that are interested in the data. So there's going to be a lot to the dashboard. There's a lot of different tables and graphs that are going to be put together. And at the point when we're actually getting ready to launch it, I'm hoping we can have an opportunity to go over it together to make sure that you all are familiar with the tool as well.
Thanks, Sophia. Austin, do you have a question?
I do, yes. Good afternoon, and thank you so much. So there was a report recently that some California counties under the new CDC's tier system have been placed there under old data. And so with that being said, with Humboldt County being placed in the high risk tier by the CDC just last week, do you believe that Humboldt County does belong there? And what will it take for us to ultimately get to the next tier?
Yeah, thanks, Austin. So I assume you're talking about the new CDC metric that was released in the past week called the CDC COVID-19 community level. We are still looking at that locally here and at the state level. And so, you know, we'll update folks on moving towards that use of that community level in the coming probably week or so as we get more information, but we are still digesting it. We just haven't had a chance to really understand it well enough. So on that, it still has us in high transmission. For the CDC data tracker, which is what we had been relying on previously, which has, you know, most of the country still in the red and high transmission. You know, that's, I think it's pretty clear that based on our cases, we are still seeing high transmission rates. Like I meant, we haven't really seen our transmission rate drop below, you know, even to the levels we saw, say, like around June 15th when we had reopening at that time. So, you know, more to come, I'd say, on all of that. Just know that we are moving in the right direction, and we'll have more clarity on, you know, those dashboards that the CDC is using in probably the coming weeks.
Austin, do you have a follow-up?
I do, yes, thank you. So kind of sticking with the CDC new metric that were issued last week, I know you say you're still digesting it, but I understand that with Humboldt County being placed in the red high risk tier, under those new metrics, the county would still need to require masks according to the CDC. So why did Humboldt County decide to go in a different direction than what the CDC is currently saying with this new update?
So they don't require masks, they are recommended, and CDPH and Humboldt County Public Health still continue to strongly recommend the use of masks. But the ability to require them has always been a local ability of a local public health authority or a state public health authority, like we've seen at different times. There has never been a nationwide mandate from CDC that everyone mask. Or requiring everyone to mask, other than in certain areas like transportation, which is still currently also there from the CDC required in public transportation. So, but again, I think, Austin, like we've seen and like we've been talking about, we're moving from requirements to recommendations as we see, you know, again, case rates come down, hospitalizations come down, death rates come down, and vaccination rates go up. So that's really what we're responding to. And I think the major changes in that CDC COVID-19 community level metric that you know likely will be what everyone will be turning to. Again, it's just too new for us to make any decisions right now. that it's based on newer data. Each time we get new data, we have to respond to it. And especially that case rates with Omicron are going to likely continue to stay high. And so relying more on other things like hospitalizations and deaths as metrics that might have more weight on what we should be doing in response to the pandemic.
Great, thank you so much.
Thank you. Christina, would you like to ask your question?
Yes, sorry about that. So my question is, you can correct me if I mispronounce this, with the current outbreak of Shigella, are we for certain that that has been controlled, and do we know exactly where the first person that got that was? And are we, I know it had briefly been mentioned that somebody possibly did their laundry at a laundromat and maybe that's how it was spread?
Christina, this news conference is going to focus on COVID-19 today. You're welcome to follow up with the HHS media afterwards with Shigella related questions, but we're going to focus on COVID-19. Do you have a COVID question?
I guess, yes. So I guess touching a little bit on what Austin asked, I guess with the CDC guidance saying that we should still be among the ones that I guess recommends being masked. Does that mean you guys don't completely agree with that list of Humboldt County being among those that should remain masked?
We are strongly recommending everyone continue to mask. So there is no difference between the CDC recommendation, the CDPH recommendation, and Humboldt County Public Health. I think what we're really moving away from are the requirements. So a mask mandate, and let's go back and look at what a public health order is. It is enforceable by law with penalty of fines and or imprisonment. It's a misdemeanor. So I think, when we think about what we want to achieve as public health, we don't typically rely on that as a tool unless it's absolutely necessary. And so we are now at a place where we are going to rely on the tools that we usually rely on, which are education and recommendations to the public. So that's where we're at. And so we are absolutely in line with CDC and CDPH. They are not requiring anyone to mask. They are recommending that everyone mask. And that is our recommendation as well.
Okay, thank you.
You have a follow-up, Christina?
No, thank you.
Okay, thank you. Isabella, would you like to ask a question?
Yes, I would. You talked about this a little earlier, Dr. Hoffman, but as you prepare to depart from your position, do you have advice for the next person to take on this role? What were some of your biggest challenges with the county's COVID response? And can you also talk about what's next for you?
Yeah, thanks for the question. I think the challenges that we've faced throughout the pandemic have been, things that we've heard over and over again. We've had staffing shortages. We've, had to respond to changes in information very quickly. We've had to respond to changes in guidance that come from CDC and CDPH quickly and help the community and the media and everyone interpret what that guidance is. So, those challenges, I think, as we go on and we are in a different place and there's less urgency to all of this, are going to improve. So I think that my predecessor will very likely hopefully not be faced with all of that like myself and Dr. Frankovich and Dr. Ennis were faced with throughout the really tough times of the pandemic. And I think that the other challenge we faced along the way has been because COVID has taken up so much of our time and because it was so deadly, we needed to spend that time on it. It meant that there were other public health and issues in the medical community that have been not getting as much attention. And so I think that, we're seeing that right now with syphilis resurgence in our community. maybe potentially with this Shigella outbreak that there might be other things that could be, sort of harbingers of what public health usually deals with. But, I think we are getting back to those, day by day, as we, like Sophia mentioned, as we really right-size the response to COVID, we continue to put folks back on, tuberculosis and syphilis and foodborne illness outbreaks and other things that we would typically do and have continued to do, but it's been hard to staff everything appropriately. So I think those are the challenges, and that, again, just that this has been an amazingly supportive community. It's a really great group of colleagues here within public health, DHHS, the JIC, OES, and just the community at large has been very supportive, and that's what's allowed us to maintain such a high level of outcomes, of good outcomes from this pandemic.
Do you have a follow-up, Isabella?
Yeah, I do. I would just emphasize the last part of my question, which was if Dr. Hoffman would be willing to talk about what's next for him.
Oh, yeah. So, I'm returning to clinical practice more part-time to allow more time with my family. Just, kind of reprioritize family life over work life. But, after that, public health is a really important part of my training and my career. And so I do hope at some point to be able to return to public health in some fashion. But for now, just a return to clinical medicine.
Great, thank you. And, best of luck in the future.
Thanks, Isabella. Sonia, would you like to ask a question?
Yes. Can you just kind of give a general picture of what kind of work you've been doing with schools and child care centers in terms of masking guidance, since they're still largely unvaccinated, and how are the vaccination campaigns going? When can parents with kids 5 and under expect them? That kind of thing.
Yeah, great questions. We've been meeting with HCOE and we met yesterday with all the superintendents of the schools to review the updated guidance from CDPH. I think we've made it very clear that we still strongly recommend that after March 11th that the schools continue to mask. But again, we move now from requirements to recommendations. We recognize that this is, there's a lot of balances in this that need to be met. This is a highly unvaccinated population on the whole, being that only about 25 to 30% statewide and locally here in that under 12 age group are fully vaccinated. But there are trade-offs. They're also much less likely to have severe outcomes. So I think that moving towards this is really something that allows each school, each community to make the decisions for themselves, and each individual to make the decision for themselves. If we felt that the risk was too high, we would certainly keep requirements in place. So we move towards the strong recommendation that we continue to hold as long as the CDC data suggests that we should be continuing with that strong recommendation. Another question we get a lot is, would we ever return back to requirements? And I think, it's hard to say. I think, after June 15th, we really were hoping that we wouldn't have to do that. And then we saw what happened in August. So it's something that the community, if locally we see something that moves away from, the state or the country, and we're seeing, very high rates here, hospitalizations, deaths are going up, then, it might be something in the future that a health officer would have to do. But we're hopeful that that's not the case, that we can just continue to, again, stay in our our current lane of offering guidance and strong recommendations, and hopefully in the future, the direction we would be moving is less of a strong recommendation and saying, you know, masks are now either recommended or just optional or not necessary.
Okay, and so I guess as far as the vaccination campaigns, are those going well? Are you seeing any kind of reluctance? And if there are concerns, what kind of concerns are parents and schools bringing to you?
Yeah, I think that vaccination in kids for COVID-19 in Humboldt County has gone well. When we compare to the rest of the state, we're actually slightly above the rest of the state, which, you know, California is above many other states in the country. So by that respect, it's going well. We still have a very low vaccination rate. I think there are lots of challenges and barriers, one of which is that you can't get this vaccine in every single pediatrician's office. There is often slow uptake in the medical community with new therapeutics and new medications. So I think that can also play into it. And I think there's a concern by the public that kids are really not at risk. And I'd say that's just not true. Kids are still at risk. The risk is lower for sure than, you know, each age group it goes up, but it, you know, we have to remember that so far in this pandemic, many more kids have died from COVID than from flu. And, you know, that's an important fact that I think is not getting out there enough. So we'll continue to work with local pediatricians, with the local medical community, with our schools to both offer vaccines and try to get the right information out there about how effective these vaccines are in kids and how safe they are in kids.
Thank you.
Thank you. Stella, would you like to ask a question? You're unmuted, but we can't hear you. Would you like to type a question into the chat and I can ask it for you? Okay, I think we're gonna keep moving. Please feel free to type a question into the chat if you'd like. Ryan, would you like to ask another question?
Yes, thank you. I have a quick one. You know, hindsight being 2020, and Dr. Hoffman, I know you've got one foot out the door here, so I'm hoping you can give us a little bit of perspective looking back on any mistakes that you feel were made or any improvements that someone coming into your position can make in terms of public information and access, transparency with numbers and that kind of thing, specifically as it relates to the dashboard. Thinking back to that time where we did have hospitalization numbers included on the dashboard during the winter surge of 2020, that seemed to be helpful for the public, sort of eliminated the out of sight, out of mind factor for many people, realizing that yes, people are in the hospital. So any thoughts as to, you know, going forward, what changes would you suggest? Thank you.
Sure. Yeah, it's always easy to Monday morning quarterback, right? I mean, honestly, I think on the whole, the numbers speak for themselves. We've done really well. You know, we always want to look and see, could we have done it better? And we will, part of any emergency response is an after action review, which, you know, has been hotly debated in public health over the last even, you know, 3, 4, 6 months. When do we do our after action review? Are we there yet? So we're continuing to look at how we've responded. We're trying to respond to things with changes. But, you know, we're never going to get it perfect, but I think we got it really right. And that's important. And again, the numbers show that. you know, some of the messaging, I think, you know, again, these were tough decisions, you know, CDC having to make a decision about masking in the early days of March 2020. I don't, you know, personally, I didn't agree with them at first, but I don't know all the details of why they made those decisions. You know, there have been other points along the way where there have been, you know, minor things that have happened that have made it difficult for us in the response. But again, you know, it's all Monday morning quarterbacking, and in the end, I think the response has been going really well, especially in our county and in our state. We've led really the nation in pandemic response, and to a certain degree the world with successes. So I would encourage anyone to focus on those successes, and you know, we can certainly always continue to look for how we could have done it better. But there's very few things I think were, you know, mistakes along the way. They were just difficult situations that had difficult answers to them.
Thank you, Dr. Hoffman. Stella from KMUD typed a question out. She said, many people received the government issued at-home COVID tests toward the end of the Omicron surge, and some people have asked, what do we do with them now? I'm hoping you can discuss proper storage, remind people when they should test despite moving into an endemic phase, and if possible, how useful these tests may be if we see another variant or surge.
Yeah, the tests that were provided by the federal government, you should definitely follow the instructions on them. They should have an expiration date. Many times throughout the pandemic, those expiration dates have been extended. So you'd always want to check and see if that was the case. If it were expired, you know, it might be extended by 6 months or even longer in certain cases. For now, all of those test kits work against every variant. So even if we had a resurgence of, say, Delta or some other variant that we haven't seen in many months, they should work against all of them. And if there are future variants that they don't work against, we would certainly, you know, be putting out alerts of how to deal with that. When to use those home test kits, I think there's a lot of discretion in that. And certainly if you feel unwell, and especially if you feel unwell and you've been exposed to someone you know has COVID, would be a really high risk situation. But utilizing them in lower risk situations, like, you know, recent travel. I just came back from travel, and we tested our family before we went back to work and school. I think those are recommended ways by the CDC. You know, before gathering with a large group, if you're, you know, going to be mingling with a bunch of people who you don't typically spend time with, you might want to use it in that situation. So there's a lot of ways you can utilize them, from more, you know, sort of surveillance approaches to certainly but you should absolutely use it if you're feeling unwell, to make sure that you don't have COVID-19.
Thank you. And Stella asks, what is the likelihood of catching COVID more than once, especially if you've had it in the past month or two?
That's a bit of a difficult question. I'd say, you know, what we know right now is that people who did get previous versions before Omicron have also gotten Omicron. So that is certainly something we have seen quite a bit of it, which is another reason we're seeing higher case numbers in this surge. People with both previous infection and who are fully vaccinated and boosted are getting it. You know, future variants, we don't know. It does look like so there's 2 variants of Omicron out there right now, BA.1 and BA.2, and it does look like the data currently is strongly suggesting that you wouldn't get reinfected with BA.2, not very likely, but that could change, and as we get more data over time. So that's something we are watching closely. But as of right now, it looks like if you got Omicron, you probably won't get it again. And it's something we'll continue to watch going forward.
Thanks, Dr. Hoffman. And I think we have time for one more question. Austin, did you have one more question?
Yeah, I just have one real quick question. So earlier this week, the state announced schools will be moving from a mask requirement to a strong recommendation. So my question is, do you believe that this is the right choice to make at this time? And for parents who may be concerned with the change, what would you say to them?
Yeah, thanks, Austin. I do think it's the right move right now. I think we, continue to move away from requirements and toward recommendations. We have the tools as a community to know how to respond to this, and it allows people to have more choice. And what I would say to families who are concerned is continue to follow the recommendations. I think that's what we've said all along. Wear your mask in public places, send your kids to school with masks, even if they're not required. I think that they offer a high level of protection. The data is very clear of that. The higher quality of the mask, the higher that protection is. The CDC just put out a really nice study showing that with a case-controlled study. So there are tools available, and I think that's why we are able now to move in this direction. We have more data, we have more understanding, and we have the tools to be able to empower people to protect themselves. That's keep using those tools, and we'll be informing the public of when those tools might not be necessary in the future.
Thank you. And thank you all for joining us. That's the time we have. We appreciate the panelists and the media for being here, and we will send recording links as soon as we have them. Have a great day, everyone.
Thanks, everyone.